Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
I'm here with Dr. Murali Kolikonda, who is a vascular neurologist. Did I get all that right?
Yes, you're right.
Okay, and vascular neurologist deals with stroke.
Absolutely.
So, we worry about stroke, we give their signs and symptoms, we try to get it out there, but tell us what happens when you have a stroke and some symptoms we might want to worry about.
Absolutely. So, I call stroke as a brain attack, which is similar to heart attack, where here, instead of heart, it is a brain, where there is sudden loss of blood flow to the brain. And it could be because of, either because of a clot or because of bursting of a blood vessel. And when this happens, you lose almost like every minute 1.9 million neuron cells die. But after that, you have, disability where you're weak and you're paralyzed, and sometimes people die from the strokes as well.
What kind of symptoms might be that say, hey, this is a stroke?
So for everyone, we have a mnemonic called FAST, which is also improvised as B FAST, where B stands for balance, where someone is having difficulty walking, and E stands for eyes, where someone is having difficulty seeing either one eye or two eyes, and F stands for face, where your face is droopy on one side, and A stands for arm, where you're weak on any of your arms on one side, and S stands for speech, where you have a speech difficulty, and T stands for time to call 911.
When you say 911, what happens? What kind of treatment is there?
So absolutely. So recognizing stroke symptoms is very important, and you call the 911 when patient comes to the emergency department based on how soon they come to the emergency department. They're eligible for acute treatments, and they're also eligible for certain clot-busting medications called TPA or TNK, where if you're eligible within like 4.5 hours of symptoms when you come, you can get the clot-busting medication where it dissolves the clot and it restores the blood flow to the brain. And there are certain times where the clot-busting medication cannot completely open the clot, where you have to go to the cath lab and remove the clot, retrieve the clot through our catheters. So there are called acute stroke treatments. That is what is available for anyone with stroke symptoms.
And you take care of stroke patients, you make the diagnosis. Now, am I right, you do some telehealth with that also?
Absolutely, and Kentucky has many rural counties, and the only way that we can have our expertise like vascular neurologists to those sites is through telehealth. And telehealth is a game changer for stroke care. And whenever patients come to the emergency department at rural hospitals, where we quickly access through telehealth within minutes via secure platforms, we see the patient and we examine them and we make treatment decisions. If they're eligible for acute treatments, we make those decisions faster, and we also facilitate the transfer to major stroke centers. And if they need higher level of care, and if they don't need to go to major stroke centers, they can actually stay at the local hospitals, and we provide the care at the local hospitals via telemedicine.
Okay, so I don't want to have a stroke. Is there anything I can do to prevent it?
Absolutely. There are certain risk factors for the stroke. One is high blood pressure, number one, diabetes, if you control your blood glucose levels, and exercise, being active, stop smoking, and decrease alcohol intake, and obesity, which is one of the major contributors as well, and obstructive sleep apnea. These are risk factors. If you can control them, you can prevent the stroke.
Is there any medicines, we talk about taking an aspirin? That yes, no, maybe?
So based on what type of a stroke you have, we give treatments based on that. There are treatments based on, we give antiplatelets to certain patients based on what is the cause of the stroke. And if there is a stroke because of atrial fibrillation or AFib, we have like blood thinners, like we give apixaban and other stronger blood thinners. So based on what caused the stroke, we tailor our management to that particular kind of strokes.
Well, that's great information. We appreciate you coming in, and we appreciate the care you give. We appreciate the telehealth, too, because in rural Kentucky, that could be important.
Absolutely. Thanks for having me.
Thanks so much.
Thank you.
We'll be right back.